Thank you very much for joining us here on News Text. Now, in our very first story, we begin from the fishing communities. And JoyNews has gathered that there's no social distancing in most fishing communities in the country, as directed by health experts. With Ghana's COVID-19 case count at over 1,100, stakeholders fear crowded communities are at risk. Now, at the Albert Bosontri Sam Fishing Harbour in Sekondi, social distancing, the use of face masks, washing of hands and the use of sanitizers are almost non-existent. JoyNews gathers fisher folks there are actually not adhering to the social distancing protocols, and we've been speaking to some owners of fishing boats, and they've been interacting with JoyNews.
The people, there are many, because this is when we're talking about social distance, you can see how the people are plenty. They can see them. Ah, okay. So good. Very impressive.
And I have been joined on the telephone by Professor Francis Nunu, who is an associate professor at the University of Ghana Fisheries Science Department. He is also the immediate past chief director of the Ministry of Fisheries and Aquaculture. Prof, thank you very much for your time here on NewsDesk. Now, the video we just saw from our beaches and London side, very disturbing. This is an aspect of the conversation we've not focused on. What is your own observation as far as social distancing is concerned at the beaches?
Yes, fisheries by its nature is a group type of profession that a lot is done together. Especially in our part of the world, a lot of the fishing activities are manual. And so from their accommodation, where they live, especially the small-scale fisheries, where the fishermen live is in some sort of shanty towns, slums, etc. So right away from their home activities, they are in groups, and it's difficult to distance. When they come to the beach, it's the same. When they go fishing, it's the same. It's a worrying scenario, and it needs a lot of innovative measures for the social distancing thing to be applied in the fisheries sector.
So the settings as we have it makes it very difficult for them to observe social distancing. What can be done to make it a bit more easier for them to comply?
Okay, so meetings can be held with them in their own town halls and at the beaches. The district assembly can come in, the fisheries commission can come in, and their own chief fishermen and their own associations can come in, and meetings held with them to try and, one, use a rooster system where people will go to sea in a staggered manner. So they will have a departure time and arrival time in a staggered manner, so that all of them will not come and arrive in large numbers, for people to aggregate in large numbers. In the same way, fish processors who are coming to buy the catch, almost every boat has got a fish mummy or an associated woman who takes charge of the catch. So these fish mummies can be well assigned to each boat, so that the crowd or ordinary persons like you and I do not crowd to go and buy the fish, so that these fish mummies will meet the boats on arrival and receive the fish, and then arrange a sell-out mechanism that will be easy to keep the social distance. Another way out would be to some of the gears, especially the drag nets. The drag nets are used in aggregation. A number of them will have to pull. Everything is done manually. We don't have the winch and others on the small-scale canoes. So for now, the Ministry and the Fisheries Commission can come in and ban the use of these drag nets. The drag nets like pear seed, the drag nets like beach stain, the one that is pulled at the beach. These ones can be banned for now because in that one they need to come together to pull, which can help in the spreading of the disease. And there are other gears. Fishermen, by their nature, can apply and use any gear at all. So there are other gears that involve only one person or two persons, or at most 3 or 4. And such gears are the traps. We have what we call fish traps, various fish traps. We have what we call hook and line. Some that are long line and some that are single line. Those ones can be applied by one person in one boat. We have a lot of one man, one boat, or 2 men, 3 men in a boat. Those ones can be encouraged. Then we have the gill net, and then we have the set gill net. Some of the gears do not need a lot of people to pull or operate. These ones can be allowed to operate in these serious times, while the ones that need aggregation is also reduced.
So yes. Please go ahead,
so these are quite a lot of things that we can do, actually.
So you mentioned education, some form of a shift system for them. You're also looking at a change in the fishing practice with the one man, one boat and all of that. Because this is a global pandemic and we know that our fishermen interact with people in neighboring countries, for instance, what do you make of the suggestion that there should be a limit on how far they can go in order to avoid or reduce the interaction they have with people elsewhere?
Yes, that should also be applied immediately. In fact, there should be a ban on, once Ghana's borders are closed, the sea borders should also be closed so that our people will not move from one place to the other. In fact, they should not move from one fishing locality to the other to fish, but basically go to sea and come back to land from one fish landing beach, which there are about 300 or so of them in Ghana, and come back to their originating landing beach. So the Marine Police and the Navy should be at work along the coast and to ensure that no one comes in from neighboring fishing countries, as well as even moving from one fishing community to the other.
The issue of the shift system, I want us to look at that a bit. How would that work practically? Because unlike our women in the market who have the foodstuff, in their stores, their wares are available. They can just move them as and when it is their turn to sell. These ones would have to go catch the fish, sell, and put some money in their pocket or food on the table for their families. What are the implications?
Yes, there will be some sort of hardship a little bit because with the rooster system, it means that everybody will not be able to go at the same time. So that's where government or the associations or NGOs will come in to try and have some package to cushion those who will lose out in not going a particular day and having to wait to go on another day. Even going on the same day, they can stagger. Around this time, most of the fishermen have got phones, mobile phones. So they can stagger and let's say everybody even goes at 1 a.m. or 2 a.m., but their arrival will be staggered so that you come about 30 minutes, 1 hour, the next one comes, and there will be some communication. Their chief fishermen and the officers and the leaders of the association at the beaches can help to moderate this very easily. Practically, it is possible when they use their mobile phones, etc., and to communicate with them. The semi-industrial vessels have also got mobile communication packages that we can communicate with them. So that too is also possible. And then we have our inland fisheries as well, those in the Volta Lake and all, that they also have communication gadgets, etc., that we can communicate and stagger their arrival so that they don't arrive in large numbers at the same time for people to mass up.
Yes, so just as we wrap up the conversation, the ministries has not made any efforts yet, not that we know of, as far as making these provisions for the fisher folk and putting in place arrangements. From your end, what efforts can you take in terms of reaching out to the ministry and making sure that this is done in the shortest possible time?
I'm an individual, and at the university, it will just be a call on, as they are hearing me, I believe the ministry and all are hearing. But I will just say that the leadership of the association to make a step to the Fisheries Commission and to the ministry for such support, because I believe they have some support. In fact, I've heard there's some support, but I don't know who they are distributing to, etc. So I'm sure they have some plans, but probably they are now working out the modalities. So let the associations of the fishermen associations make moves to the ministry, and I believe that some support mechanisms will be put in place to cushion our fishers in these difficult times.
Professor Francis Nuno is a professor. He is with the Fisheries Science Department at the University of Ghana. I apologize for that break there. We'll go back to that feed once we correct that. But the Food and Drugs Authority is warning of potential danger as inferior and unapproved nose marks flood the market. Officials say some of the products fall short of the recommended 3-layer specification and expose users to risk. Head of FDA at the India Ashanti region, Nora Naki Telabi, once says this warning comes as the Regional Coordinating Council serves notice it will make the wearing of nose masks mandatory from Wednesday. Himinteria of our health desk reports.
Virologist at the Kumasi Center for Collaborative Research, Dr. Michael Owusu, called for mandatory wearing of nose masks after the partial lockdown was lifted.
I expect nose masks to be mandatory, that everywhere anybody goes, before you go to a trotro, a public transport, every gathering you go, the first thing is that you must be in a nose mask, and the police must ensure that whoever goes out has a nose mask.
Ashanti Regional Minister Simon Osei-Mensah responded by announcing residents of Kumasi would be compelled to wear nose masks.
Everybody should be able to acquire the face mask today and tomorrow. If we see you maybe without face masks and you are in public, we can return you to go back home until you get the face mask on.
The streets of Kumasi have since been flooded with all sorts of nose masks, both foreign and locally made.
Yakofano 1 cedi, near the Aje 2 cedis. Tiama Yetiminya Bikura 80 pesos. Na Yadi Aje 2 cedis.
The FDA, however, cautions hundreds of products being sold to the unsuspecting public are unapproved.
We sampled quite a number of nose masks, and as you can see here, most of the nose masks are just 1 layer of fabric. Some of this, for instance, looks like polyester, which would not be able to filter anything. Some of them have cotton, which is good, but they are only 1 layer. This one I have here is 2 layers, and so they don't meet the guideline for making masks that the FDA has brought out. So we would like to educate the public on the guidelines that we have brought out to enable them produce nose masks that can protect the public and all of us.
Nora Nakite Labi is the Ashanti Regional Head.
We have recommended a 3-layered system where you have the calico as the outer layer, you have stiff, and then the 3rd layer, which comes through your person close to your mouth, should also be calico. Otherwise, the second option also is 3 fabrics, that is calico, calico, calico. If you sew it together, it's able to filter this virus out, and also it is reusable. You can use your cotton fabric for the outer layer. Make sure that the middle layer is either the stiff or calico.
Himinteria brought us that report. Apologies once more. We'll return to that feed once we have it corrected. Now, Sisala West District Director of Health has expressed worry over inadequate personal protective equipment for personnel of the hospital. Now, Cecilia Kakraba said the district could only boast of 5 protective cover cloth, and when they had 2 suspected cases, they had to limit the usage by reducing the number of people who had to attend to the patients. Now, Now, worst of all, there's no single infrared thermometer in the whole district, making it difficult for them. Cecilia Kakraba made a statement when the Upper West Regional Minister, Dr. Hafiz bin Salih, met with members of the Sisala West Public Health Epidemic Committee at Bolu. From where JoyNews' Rafiq Salam reports.
Sisala West District Director of Health Services, Cecilia Kakarba, vividly recalled the programs undertaken by the District Public Health Epidemic Committee in fighting the COVID-19 pandemic and cerebrospinal meningitis (CSM). We, together with NADMO, we registered all traveled in people who traveled from Accra and Kumasi. Those when the effect was in Kumasi and Accra. Now it's everywhere. Those days, that's about 2 or 1 month ago, we did registration, and then just Monday and yesterday Tuesday, we went around and took sputum sample of 97 of them. We could not trace all of them. Some went back, but we were able to take 97 traveled in the district sample yesterday. She didn't open up on the logistical challenges they are facing. But our key challenges, as I said, have to do with the infrared thermometers. As a district, we don't have a single. The hospital was having one thermometer. As of now, it's also broken down. So we don't do triaging at the OPD level, which is very risky for us as a district. Very, very risky. We don't have the masks, the face masks, which is now the general declaration that everybody, if in a hospital setting you don't wear a mask, then one can can imagine what will happen. Then gloves, which is key. Now we have to be in gloves and masks before we touch whatever. And then the protective coverall. When we had, the region gave us 5, and we have 2 suspected cases. And because we even have to minimize it or to manage it, to limit the number of staff that will have to attend to the client, because we do not have the PPEs. So we limited. It was doctor and maybe another 1 nurse that we assigned to attend to that case because of the lack of PPEs. And so that is not adequate. For now, I think we have just 3 or how many as a district. Upper West Regional Minister, Dr. Hafiz bin Salih Kring, upon hearing of the myriad of challenges, and donated his personal non-contact thermometer and 2,000 Ghana cedis to the Sisala West Health Director with a promise of adding more.
Having said that, only a few days ago, I took delivery of some items from a worthy son of the Upper West Region, Alhaji Yusuf Yakub, the Managing Director of Yusuya Ghana Limited. And we distributed the items, and your hospital is a beneficiary. So it is no longer the case that you don't have infrared thermometer, because among the items we allocated 1 infrared thermometer to the district, among many others.
The Sisala West District is yet to record a single case of COVID-19, but for CSM, they have recorded 8 confirmed cases with 1 death. Earlier, the Upper West Regional Minister met members of the Sisala West District Security Committee, which was held behind closed doors. Reporting for JoyNews, Rafiq Salam, Bolu.
Let's go back to the University of Ghana, where the COVID Connect app is being launched. As we speak, the app has been demonstrated to the audience.
Right. I think we have enough brief about the COVID Connect. I will not waste my time, but together with Prof. Lawson, declare the COVID Connect launched. So, it is duly launched. The next thing is just to take us through the processes that we have to go through to get the app done. Okay.
UGMC COVID Connect.
I'm Dr. Wilfred Asma.
I understand you have a runny nose.
It doesn't necessarily mean you have COVID.
Hello.
This is UGMC COVID Connect.
I'm Dr. Wilfred Asma.
I understand you have a runny nose.
It doesn't necessarily mean you have COVID-19, and that is why I need you to calm down so that we do the best we can to help you.
COVID Connect, a digital service, connects you to the medical team at the University of Ghana Medical Center for quality medical support, expert psychological counseling, testing, and in-hospital management. Access COVID Connect by downloading Lucy Vitals on Play Store or iOS. COVID Connect is brought to you by the UGMC, the Ministry of Health, and supported by the Farm Access Foundation.
COVID Connect. And this is a platform which is created with Farm Access and UGMC. The whole idea here is to let patients download this app, which will monitor real time and then manage them appropriately from wherever they are. This app basically will assess the risk of these patients into different categories: low risk, medium, and then high risk patients. With low risk patients, definitely there wouldn't be the need for any contact. Once the patients are categorized as medium, it triggers to train personnel doctors with UGMC who will follow up with these patients and then monitor them based on the treatment guidelines or the case definition that has been ascribed by the WHO. By doing so, these patients are taken care of from their comfort in their homes. And when they need be or they go into complications, they come to UGMC where it has been designated as a treatment center. So this platform has the advantage of defining a care path for patients right from their homes through to the center as at when their conditions change.
I'm Dr. I understand you have a runny nose.
It doesn't necessarily mean you have COVID-19, and that is why you need to come.
In case you were wondering whether this is the same thing as the GH COVID app that was recently launched by the Ministry of Health. One distinguishing feature of this app service is that it is more of a service being provided by experts here at UGMC. The GH COVID app, which was launched, is more of contact tracing app, and so it's more of trying to locate where people who have been exposed to people who have COVID, people who have had an interaction with COVID patients. So this is the major distinguishing feature between the two apps. This is an actual service. It's almost as if you were at the hospital or at the center and you were seeing your doctor and telling him or her of your symptoms and everything. And you'll be giving medical advice, counseling if needed, and in-hospital management if required. At this point, I would like to call on Dr. NP to give us some explanation in terms of the demo. We are going to go for a tour at the conference center at Building 1. I always say that the sweetness of the pudding is in the eating of it. We will all have a feel of how the care coordination center feels like and what is being done there. And he's going to give us an address or a little explanatory address as to what to expect when we get there. Thank you.
Thank you, Barbara. So don't be afraid, we are not going to give another address. So this is a service. It is not an app. It's a service. The app is an enabler. One of the key components of the service is what we call care coordination. It's not a call center because you cannot call in. It's a care coordination center. All the patient symptoms come in through the application. This is monitored by the medical team. If they need to call you, they will call you. If they need to contact you, they will contact you. If they need to connect you to the testing team, they will connect you to the testing team. If they need to connect you to psychological counseling, they will do that. If they need to call you, of course, and bring you in, there's already an ambulance service in-house that is in place to do that. If you need to be linked to your own hospital, it's an arrangement to make sure that you visit your own hospital as well. So it's a broad service that is provided by we have line 1, who are the medical officers and senior medical officers, and line 2, who are the specialists. So that if there's any patient who is above line 1 by the categorization, they'll be forwarded to line 2, the medical specialist, to have a look at. So there's already a team at the Care Coordination Center now. So after the vote of thanks and the closing, we will take a tour of the Care Coordination Center because we need to do it in social distancing. For those of us who have already been there,
Since we're having a challenge there, we're taking a break here on NewsDesk. When we return, we'll bring you more. Stay with us.
Hello, welcome back to NewsDesk. My name is Darryl Carl. Time for some business news. Standard Chartered Bank Ghana has pledged a 1 million cedi fund to support initiatives aimed at fighting coronavirus. Managing Director of the bank, Mensa Nete, disclosed that the fund is aimed at procuring essential materials to help frontline workers in their duties. She made the disclosure when the bank presented some personal protective and advanced testing equipment to the Noguchi Memorial Institute for Medical Research and Ridge Hospital in Accra. There's more in the following report.
Being the latest to join in the cash and kind donations to help in the fight against COVID-19, Managing Director of Standard Chartered Bank, Mensa Nete, said the support was to help ease the pressure on health institutions in the front line against the global pandemic.
We thought we had to step up and support the country to fight COVID-19. So we are looking at an initial donation of 1 million cedis towards giving out protective PPEs, giving out testing equipment, also towards the use of giving out items to the vulnerable community. And I had indicated also that a focus of ours is to focus on the vulnerable children. So we'll be coming out with more programs to support the vulnerable children in terms of their support for learning while the schools are closed down. So this is just a beginning, as I indicated to you, in terms of the support that Standard Chartered is coming out. You know, Standard Chartered is here for good, and anytime there's a need like this, we come up to live our Here for Good promise to ensure that we are supporting the wider community to fight COVID-19.
She spoke to journalists after the bank distributed some health materials to the Noguchi Memorial Institute for Medical Research and the Greater Accra Regional Hospital.
So Ridge Hospital, we're focusing mainly on, as you know, that Noguchi does the testing, and yes, it's a diagnostic center and does the testing. So we're focusing on providing the equipment to Noguchi that they need. With Ridge Hospital, we've assessed their needs, and we're providing PPEs for the nurses and the frontline workers.
Thank you. After taking delivery of the items, Director of the Noguchi Memorial Institute for Medical Research, Professor Abraham Kwabena Anang, expressed gratitude to the bank. According to him, the center will be making use of advanced laboratory technology to speed up the country's testing. He believes this will help in dealing with the pandemic faster.
All that we have to do now, which we would want to communicate to Standard Chartered, is that we are going to look at how best to leverage this equipment to augment or to increase even our ability and capacity to do testing for COVID-19. And we shall share this information with our brothers and sisters, with our very, well-founded now partner. And I would like to conclude by saying that we feel this donation from the bottom of our hearts.
The two centers have been in the front line of the fight against COVID-19 in Ghana.
And you're still watching a news desk. We want to take you back to a coverage of the COVID Connect launch that you see on your screens.
Okay, doctor, yes. Doctor, patient, please.
Yes, so I feel unwell, and I saw this app. I have downloaded it, and I'm going to password. Okay, so I've downloaded the app. I don't feel too well, so I'm going to use the app to contact a doctor at COVID Connect UGMC, and then my response will be given to me. So the first symptom on the app is loss of smell. So I press on the start button, and then there's a short description of what loss of smell is. So after reading this, I go to next, and then yes, truly I have lost my sense of smell. So I enter yes, next, and then I send to the center. The next symptom is breathing rate. So there's another short description of what breathing rate is. So I press next, and then I'm going to count my breathing rate in 30 seconds. If I have somebody close by me, it is better to let the person count the rate for me. So, in fact, my breathing rate is very fast, so I'm breathing about 20 cycles in 30 seconds. So I enter 20 and then next and send to the center. My next symptom is temperature. There's also another short description of what your temperature is: below 38 degrees, between 38 and 39 degrees, and then more than 39 degrees. If you have a thermometer by you, well and good. You check your temperature and then you enter the value there. So I press on next, and then I feel so hot. The thermometer I used gave me 40 degrees. So I enter 40 degrees, next, and then I send. My next symptom is cough. I press on start. There is a short description of what cough is, and then I am seriously coughing, so I'm going to press next, and then my symptom score is about 7. So I enter 7, next, and then I send to the center. My next symptom is sore throat. I press on start, and then there is a short description of what sore throat is. Next, and then truly I have a sore throat, so I enter yes, and then I send. After reading then there is the next symptom, which is shortness of breath. So I enter, start, and then there's a description, and next. So in fact, I'm very, very uncomfortable, so I enter 9, send, and then it goes to the center. When I downloaded the app, I was told that the team will get back to me within 24 hours. But I feel 24 hours is too far a time for them to get to me. So I request that they call me immediately. So I press on start for phone contact, and then I enter the reason why I want to be contacted. So I can hardly breathe. In fact, I can't just do anything. So I enter the reason why I want the team to contact me. And so I save, and then I send to the center. After this, I wait comfortably and patiently for the team from UGMC COVID Connect to get back to me.
You have to do it again.
You have to do it again.
You need to because the slides are not advanced.
So I am Dr. Parifi, and I am processing the input. So I see here that my patient, Solarfi, says he can hardly breathe, and he requested a phone call. So I'm going to call, I'll process this. And I'll place the call. Hello.
Hello.
My name is Dr. Barbara Sarifie. I am with the University of Ghana Medical Center with the COVID Connect team. And I saw your alert, and so I'm calling you about your symptoms that you put in.
Yes, Doc. I woke up this morning and I feel so sick. I can't breathe, I'm coughing, and my temperature, my body is very hot.
Okay, so I see all of this, and indeed, these symptoms are very important symptoms that we have to address as soon as possible. Where do you stay, please?
I stay at East Legon.
Okay. University of Ghana Medical Center is very close. We are in Legon. So you can come here or you can go to the nearest healthcare center so that we will take a look and address all your concerns appropriately. Will you be able to do that?
Yes, doctor. Right away.
Okay. Thank you very much.
Thank you too, doctor.
Bye.
Bye.
So this is just one patient who has been processed. And once you are processed, you are put into a category. We have about 6 categories that we put patients in. So depending on your category, then we offer you the needed service. So the first screen that you saw, the start button, when you press on any of the start buttons, it gives you the category, the measurement. So if you punch 6, we have an interpretation to the number that you have punched. You punch 1, so based on the measurements that we get from you, we're able to categorize and say that you are high risk, you are low risk, you are a healthcare worker, you are okay, you can say, or you are an emergency we need to attend to. So no matter where we are, once we have connected you to a service, then we'll follow you up to make sure that we have given you the full range of services that you need. So from this one, we saw that the doctor patient is living at East Legon. We can bring him in. If you are somewhere, let's say Kaswa, they want to see the kind of care that you are giving, and if we need to follow up to offer you more services, we do so. So this is how the COVID Connect is going to work. So if you take any of the interfaces, you will see that the measurements are there, and you are doing the measurements. Because people are doing their own measurement, we know there will be some variations, but we know how to handle all those variations to make sure that everybody gets the needed service that you need to have. So this is COVID Connect. You can try it yourself, and then we'll be here to process you. If we think that you don't have a challenge, we'll let you know.
Just trying to download the app, but I think it's not open yet to register. Okay. So maybe...
Yeah, so that will happen once it's launched, that will happen. And once it's launched and it's open, we've started work now. All my colleagues here are here today to make sure that we can right away respond to any of the calls that we get. So that's the service we have.
I want to ask a question.
Yes, please.
This one was a good patient.
Yes.
But assuming you tell him to go to the nearest facility, and then he said, no, I'm not going. Because if I go and it's positive or something, the stigma, what will you do?
Yes, so we know those issues will come. You know that wherever you are to be connected to the, if you just need a test, you are supposed to be connected to the district to do the test for you. If we think that you are thinking of stigma, then we can't do that, then we need to find a way of connecting you to our facility through the Legon Hospital. You know, we are a treatment center now. And because we are a treatment center, we are not offering directly testing. You ought to come in positive. So we have the collaboration with our sister facility, which is Legon. So if you think we have a problem, we can arrange to bring you to Legon to do the test for you. And once you test positive, then we categorize your disease and say that you are mild, moderate, severe. You are severe, please come in. You are moderate, please come in. You are mild, we can give you home care. Or you are mild, but you can't do home care because of what director nursing has, which is stigma. So if someone has asymptomatic disease and yet has stigma, that person cannot stay home. So we'll bring him into our facility and offer him the service.
Okay, the next question. Let's say after he called.
And so that is the launch of the COVID Connect. It is an app by the University of Ghana, and that will give you access to the medical team at the University of Ghana Medical Center. That is quite different from what was launched by government, which is essentially to give information and help, efforts of contact tracing. This one will give you some medical attention directly. And that's it for News Desk. Many thanks for your company. Up next is Najali with JoyNews Interactive. Stay tuned in.